The member from Niagara Falls.
Thank you, Mr. Speaker, and I'm very happy to see the Leader of the Opposition Party bring this motion forward today. This government's cuts to our healthcare system are putting patients at risk. That means our seniors are at risk, our children are at risk, and we are at risk. I'm also very happy to see that there's so many doctors that are here today. Before I get into my speech, I want to thank each and every one of you for the work you do every day. And I know that without the doctors like you, I would not be standing here today to give this speech. And I mean that literally. In my past, I had a very serious, life-threatening health condition. And without the great work of the doctors, the nurses, the support staff, I wouldn't be here right now. And I know the doctors that are listening, you know what it is. I had a valve put in my heart, mechanical valve, which is very interesting. It goes click, 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 click when it's quiet. I'm on warfarin. And I guess my question is to the parties over here when it comes to the doctors and having contracts imposed on them. When a CEO of Hydro is paid $4.3 million per year, are you trying to tell me that doctors aren't more valuable than a CEO of Hydro? You deserve to be treated better. You deserve to be treated with respect. And from the bottom of my heart, from myself and my family to the doctors, I say thank you very much for what you do every day. The Liberal government's short-sightedness decisions on health care has caused chaos. Cuts have left 800,000 people without a family doctor. The cuts have left people in remote communities struggling to get the care they need. And the cuts have resulted in nurses and doctors leaving Ontario to find work elsewhere. Now, I know that on days this government will willingly to admit that they made these cuts, but that doesn't come very often. And like they spend that time blaming the federal government, the Conservatives over there. Well, I think it's safe to say we're going to see a lot less of that now. And it's a good thing, because we all know that what really causing these cuts is a government wasting millions of dollars to cover up scandals. Some of those scandals like eHealth, Orange, are related to our healthcare system, but more of them are not. The gas plant cover-up and the recent Sudbury by-election. This government has taken money out of our frontline services and used it to cover up. Instead of protecting the interests of Ontarians and making sure they have health care they need, they have protected the interests of their party and to make sure they have the votes they need. Mr. Speaker, and I've listened to the party, the Liberal Party, the cuts to health care have a serious impact in my own riding. 10 years ago, the town of Fort Erie was booming. Its population was growing. Its economy was growing. And thankfully, it still has one of the best tracks for horse racing anywhere in the world. And it had a fully functional hospital. The people of Fort Erie really liked having that hospital in town. It meant they didn't have to drive 45 minutes down the highway to an emergency. It meant that the babies made in Fort Erie could be delivered in Fort Erie. In fact, they liked their hospital so much they had fundraisers and purchased equipment for their hospital. That's right, folks. The people of Fort Erie used their own money to buy equipment for a hospital when their government wouldn't. And what do you think the government response was to it? Do you think they congratulated the people of Fort Erie? Do you think they realized their mistake and actually purchased the equipment that was needed for our doctors? Do you think they learned from this and made sure other hospitals had the fundings they needed? Well, I wish I could stand here today and tell you they did all of those things, but I can't. What I can tell you is that they closed the Douglas Memorial Hospital in Fort Erie. They closed up the hospital and took the equipment to St. Catharines. Well, let me say that again. This government took the equipment that the people of Fort Erie paid for themselves with their own hard-earned money and shipped it 45 minutes down the highway to a new hospital in St. Catharines. As I've already said, that put people at risk. Fort Erie as a town has been hit hard in the last 10 years as manufacturers moved out of the province. It's a town that needs to attract more people to increase its tax base. And now it's a town that has no hospital. How is that going to help it grow? Well, simply put, from closing the hospitals to removing slots from Fort Erie Racetrack, this government has put hardship after hardship on the backs of people of Fort Erie. Rather than helping their community grow, the government has made it harder for them. It's time this government start reversing their cuts and helping Fort Erie become a booming town that it was before. And let's talk about Niagara Falls. I'll tell a quick story about Niagara Falls. I only get so many minutes here. Niagara Falls, 14 million people go to Niagara Falls for the honeymoon capital of the world. And guess what they do there? They make babies. That's what they do. They go to Niagara Falls, they make babies. But guess what we can't do in Niagara Falls? Because they took the maternity out of the hospital, we can't deliver the babies. They got to go to St. Catharines. Does that make sense to anybody? Absolutely not. And what's that do? It impacts our health care cuts. That's hurt my riding. My riding has more seniors than just about anywhere else in the province. And after all, we have, in my slightly biased opinion, the best place to retire in the province. Not to mention the fabulous wines, the craft beer, the natural beauty, right in the heart of Niagara-on-the-Lake. However, having a large senior population has its challenges as well. Of course, the main challenge is that we need to be able to provide health care for seniors who live in Niagara Falls, Fort Erie, Niagara-on-the-Lake, and everywhere in between. And you shouldn't have to drive 45 minutes to get to a hospital. Mr. Speaker, maybe you're one of the lucky individuals who's still able to see a community nurse rather than have to go to the hospital. Well, unfortunately, for those nurses who have also been impacted by the Liberal government's cuts to our health care system, and this is a story I think you should listen. I want the doctors to listen because they can really relate to it. The nurses of OPSU, Local 289, have been on strike for 6 months now. This government decided to privatize the services that Local 289 provides in order to save a few bucks as parts of the cuts. Now the private company, owned by Linda Knight, that has taken over is paying these nurses a wage that they can't even make a living on. Her company, now think about this, her company is bringing in nurses from across the province, putting them up in hotels, paying their meals, all the while saying they can't afford to pay nurses properly. I encourage the health minister, I wish he was here, to fix this injustice against the workers and the community and, quite frankly, the patients that are there. And you want to wonder, I know I got a few minutes left, but you want to wonder why we have a crisis in health care? Let's talk about why we have a crisis, why they're looking at cutting, outside some of the scandals that you had. Let's take a look at what we've done with money, because I keep hearing how we put more and more money into health care. Well, it's not true. The money's going to health care, but where's it going? Now, let's talk about the LHINs. They put the LHINs together, so the money's going to the LHINs. And what's the LHINs do? They have executives, they have CEOs, they have all these people. And then, what do they do with the LHINs? They make a decision to put an envelope together to give that envelope to CCAC, who then has their own boards, has their own workers, again, taking money, first it goes to the LHINs, goes to CCA. So now what they do, CCAC, in my case in Niagara, guess what they decide to do? They contract the work out to a company called Care Partners, who now is a profit company, who runs a health care, and what do? They put those workers and they pay them $15 an hour, and it's actually closer to piecework for a nurse in the province of Ontario. Now think about it. You guys know what I'm talking about. They go into the homes of these people. They have diabetes. They have serious problems. And they're being paid $15. And they got 9 or 12 minutes. So I'd talk to you, sir.
Sit down, please. You know, you can't talk to the gallery. You're supposed to talk to me. Thank you.
Thank you, Mr. Speaker. I just was showing a little bit of passion there. But I want to say to everybody, that is the problem with things. So Care Partners decided to put them out on strike at the expense of the patients, at the expense of my community in Niagara, and not just Niagara Falls, St. Catharines, Thorold, all that they service. And why they do it? Because they're getting the dollars to provide the service. They did it because they didn't want to have a collective agreement. It's the first collective agreement. They want to break the union there. And I think the Liberal government should be ashamed of themselves of what they're doing there. And the nurses have said, that's not enough. We deserve to be able to live with our jobs. We deserve to be treated with respect we have earned. But that's not what this government is doing. From our doctors to our nurses to all of others who work so hard to make our healthcare system great, this government has turned up their noses and said no. No, we won't give you the funding you need. No, we won't pay you a fair salary. And no, we don't have the money. And I just explained to you that it's not a money issue, it's how you distribute the envelope. And the envelope has to go to frontline workers, it has to go to the nurses, it has to go to the doctors and the support workers. And when you finally realize that that's what has to happen to healthcare in the province of Ontario, we'll be a lot better for our seniors, our kids, and our grandkids. Thank you very much. Give me a couple minutes of your time.